new generation of dentists coming out with a very, very different mindset right now. And they are coming out of very social media style entrepreneurship, which is very unrealistic. I know they're coming out of school or they have 1 year of experience and they really need that mentorship. And we thrive on the fact that we are going to provide that. It's not the mentorship on fillings and simple extractions. The mentorship is mostly on them coming out from their school setting mindset into a clinician's mindset. How to talk to the patient, how to look at a treatment plan, how to look at, if you're taking insurances, how to look at insurances beforehand while the assistant is taking x-rays. I think mental support and encouragement is what they're looking for.
Hello, everyone, and welcome to another episode of our podcast. We are so excited for our guest today. But before we can get into all of that and the truth that she is bringing to us, we're going to pass the time over to Dallin, and he's going to take us through the Ask Dallin segment.
Thank you, Ken. Also super excited for our episode today. The question that we received from our listeners is one that I hear pretty often. Question is, do you recommend any off-the-shelf analytics platforms? So when we're talking about off-the-shelf analytics platforms, we're referring to a Jarvis, Dental Intel, Open Dental, Clarify Health, that kind of thing. A software that you can plug into your practice management software and get reports from. So there's a couple of different nuances to this question. When it comes to technology, the question is always build it or buy it. If you choose to build something on your own, then it's customized. It works exactly the way that you want it to, but it also takes a lot of time and resources and talent. If you buy something off of the shelf, it comes ready to go on day one. Maybe there's a little bit of customization that goes into it, but for the most part, you can be up and operational quickly. However, it won't be super customized. In an analytics situation, it can be difficult to determine how the numbers are defined. So like, what is a new patient? What is a canceled appointment? How are adjustments factored in when you're thinking about net production? Those questions can sometimes be difficult to answer with off-the-shelf software. So my recommendation would be, if your organization, for whatever reason, isn't standardized, if you are not on the same practice management software, if you are large, if you're working with a lot of different operational processes, and if you have the technical capability, you should build something in-house. You are going to continually be frustrated by off-the-shelf solutions. However, if you do not have the technical capability, or if you run a really tight organization, you've got standard processes, you're all on the same practice management software, then you will probably be safe using an off-the-shelf analytics software. And that's what I got. Back to you, Ken.
All right. Thank you, Dallin. Now, so excited to introduce all of you to our guest today. I want to introduce you to Nazish Jafri. And Nazish, why don't you just start us off and tell us a little bit about yourself, and then we'll start to unpack the truth that you have brought to discuss today.
All right. Thank you, Ken. And thank you, Dylan, of having me here. It's an honor to speak to you. And I really was listening to how you were describing the choices that sometimes you have, and you have to pick, one for you that works just best for you, and not it's like fed to you or, pushed to you. So, yep, you're always making choices in life. Well, my name is Nazish Jafri, and I am the CEO and a working clinician for Secure Dental. It's an organization that me and my husband made in 2012 after being associates for 5 to 6 years for the DSO. So we really enjoyed the DSO. We were very happy with it because, our earnings was coming from there. We were paying our loans from there. So I had all good things to say about it. But then we were capped. We couldn't do a lot of endos. We couldn't bring in technology in there. Obviously, DSOs are different, and they were different at that time. So we were like, okay, we wanted to do implants. And then we started going out and building our own organization. We didn't realize that we would like that part because the first one was a tough one. Nobody wanted to give us a loan. We started off with 3 ops only. And right now I have 8 offices, 8 functioning, very healthy offices with very close-knit colleague style associate relationship, which I'm very proud of. We do hire, and we do have recruitment going out through LinkedIn and stuff, but most of my associates are all internal referrals, and that speaks for itself because they get their own people to come and join
Yeah,
us. So
it's
it's a very
amazing.
close knit community. So this is in a nutshell. I'm also a mom of 3 kids. So I have 3 kids of my own that I take care of, and then I have a full DSO of 120 people that, that we have to take care of. So I'm very proud of it. I'm very privileged that, we have a means that pushes everybody's household through us. And I'm, there to help it out.
Well, that's so fantastic. Thank you for sharing that little bit. Obviously, there's so much depth behind what it takes to run an organization like you've built. It's impressive. So why don't we go ahead and jump in? And why don't you tell us what your truth is that you want to talk about today? And again, these are the things where it's just things aren't working in the industry the way we want it to be, and we want to hear what you're thinking about there and how we can improve it.
Yeah. So like I said, we have a very referral based associate who join us, and they join us right from New York School of Dentistry or Michigan College of Dentistry because our own associates recruit them because of the way we work and we have autonomy. One of our associates had to leave because she is getting married and we had a space to fill. And we started doing outside recruiting, and I'm getting to do interviews firsthand. And what I'm starting to listen to is this is the new generation of dentists coming out with a very, very different mindset right now. And they are coming out of very social media style entrepreneurship, which is very unrealistic. They don't know that when they come out in the market, what are they actually looking for? They're looking at all these posts from all these gurus and all these really good clinicians who are posting their really best stuff in there. And these kids think that this is what they're going to do first day when they walk into any job. And they don't really understand what goes inside it. They sometimes don't even know how much their monthly expenses and how much are they supposed to make. So when I'm doing their personal financial goals, I don't ask them, do you know how to make a class 1 cavity? Do you know how to do an extraction? That's the school has taken care of it. What I'm asking them is, what is your goal? What do you want to do? What do you think you're going to provide value in my office? How can I have all these systems. What are you going to do? They don't know. They ask me, how much money are they going to make? I'm like, how fast can you move? Right? They think that the patient is going to come first day and they will have something written on their forehead that I need an implant or I need like 10 veneers, so it's very unrealistic. Expectations are very off, and I feel bad for them because when they come in the main market, they have to start right from the scratch, right? And there's a little disconnect that I feel. And I really want to see and I want to help them achieve their goal, definitely. But setting expectations right is important.
Yeah, this is a fascinating topic. We've been hearing more and more of this in some of the podcasts, and just obviously being in and around the industry all the time. It's a really interesting thing. I'm interested if you could share what type of a framework do you try to build out to help these associates start to make the decisions about what they want to do with their lives and with their careers, and what their goals are, like you were discussing.
Yeah, absolutely. So when we get them on board, well, we start this from the interview process, and then they go to the office and they really look, they see if it's a good fit for them. They have opportunities to ask questions. I'm not there, so it's not a bias thing, so they can look into it. When we get them hired, we have a good 1 month sort of training period that we give them as an expectations, because I know who I'm hiring. I know they're coming out of school or they have 1 year of experience and they really need that mentorship. And we thrive on the fact that we are going to provide that. It's not the mentorship on fillings and simple extractions. The mentorship is mostly on them coming out from their school setting mindset into a clinician's mindset, how to talk to the patient, how to look at a treatment plan, how to look at, if you're taking insurances, how to look at insurances beforehand while the assistant is taking x-rays. Let's discuss before. So I'm sitting with them hand to hand. They're attached to my hip for at least 2 weeks. And we're brainstorming before we even go inside the room. So we use Ascend and Ascend makes it very easy for us so we can treatment plan together. The x-rays, I'm giving them words, I'm asking them questions, so they have a framework in their head, and now they can go in confidently and they can ask questions or be more of a provider than a new grad. Otherwise, when I was there, the first day I remember I was there, I was chicken with no head. I didn't even know how I'm going to talk to a patient. Is somebody going to come check my filling because I'm coming out of a school background? So I was thinking somebody has to come check my filling. Somebody has to come check my anesthesia. I have to ask somebody. But here, because I've been through it, and that's the pledge that me and my husband took, that we're going to train them. And this is the mentoring that we're teaching them, not clinical skill mostly. It's mostly how you present to yourself, to the patient, so the patient trusts you, and then you can hold that handpiece to do the beautiful work. But if the patient doesn't trust you, they'll say, okay, I'll come at my tax time.
Yeah, man, I think that is such an impressive level of mentorship. And it's
Yes.
something that is critically needed in DSOs right now, especially for new hires. I was just reading a report this morning from a generational psychologist. So, someone who studies different generations like Gen X, Gen Z, baby boomers, like that sort of thing, and analyzes how different generations think, as specifically applied to the workforce. And one of the key insights in the report I was reading this morning is that people who are graduating right now, so this current generation leaving college, wants mentorship more than any other generation before. The Gen Xers, you could just stick them in their job, leave them alone. That's what they wanted. Like, they wanted the opportunity to do something hard, to prove themselves, level up on their own. But the current generation leaving school really wants someone there to show them the ropes and to give them support and help them recognize when they're doing a good job or when they need correction. So just with that context, I think that the level of mentorship that you are providing for these new grads is really impressive and really needed.
You said that so right. They are looking for mentorship. And sometimes people think mentorship is just hooking them up with a senior associate in the office, and that's fine. But they don't realize that that associate is working his hours as well. So how is he going to help this other one? They probably sometimes just go and do the extraction for them. They just sometimes go and do the crown prep for them, whatever, or place the implant. I don't think they're looking for that. My experience is they're looking for somebody to bring them out of their little cocoon shell so they can become confident. And I'm just there in their head. I'm like, you're doing a good job. Keep on going. Don't worry about it. I'm right here. Don't worry about it. I'm right here. I'm on your speed dial. They just need this. And I've seen, even if a file breaks in a root canal, they're doing a root canal and a file breaks, they know I'm on their speed dial. They can text me and they say, hey, Dr. Jafri, the file broke. What should I do? And I'll give them a quick tip or something like that, just to support them. I think mental support and encouragement is what they're looking for. And their skill just comes in with that support. They're like, okay, there's nobody critiquing me. There's nobody honing down on me. Yes, sometimes production is needed, 100%. We're in a business. You have to feed families. You have expenses that you have to pay. You have to make a production. Well, once you encourage an associate in a right way and they know you have their back, I have seen really good results in our office. Around like 4 to 6 months time, they are just so sharp and focused and confident in treatment planning that they just keep on going after that. I don't have to worry about it.
Yeah, it's such an interesting just the dynamic is extremely interesting to me, but what's also interesting is the investment that you
Yes.
have to make in order of your time and your effort and your mind share and everything to train these associates. And you're not the only DSO that's fighting with this. Fighting's not the right word, but that's trying to figure
Yeah.
out how can we give the doctors the support, these brand new doctors the support that they need, but not have to take the number one producer out of their role to go around and start training everybody or
Yeah.
any other certain model. So it's really an interesting challenge that the dental industry is just going to have to start to figure out and get better at. What are your thoughts around that, Dr. Jaffrey? How do you sort of think about that or process that?
That is right. It is challenging because one person, like obviously when you are a DSO owner, you're a clinician yourself and you work also yourself, you cannot replicate yourself like that. You cannot be in so many different places. What I think is if I replicate 3 people just like me, my mindset, so the interview is very important. The goals are very important for us, for my organization. I don't ask them questions about their feelings and how they do their stuff. I ask them, what is your goal in life? Tell me what your goal is for the first 6 months and first year. And we hone on to it. And I'm very particular about sitting them down in 6 months and asking them, did you reach your goal? How can I help you to reach your goal? So we are working not on the clinical aspect. We're really working on their mental aspect. So when I train them, they become like me. They see what I have brought into them. And then after a year, 2 years, if I need them to mentor somebody after we've done the 2 weeks, I have full trust in them that they're going to speak the same language. So we're very close. I just don't, because I know if you go in a DSO, they put you in a room and you just never see the owners or clinicians till ever. I never saw them. I never met them. In ours, we want to keep it close knit and I replicate myself so I know everybody's speaking the same language. And it takes a lot of time and effort.
Yeah, huge
Yeah.
investment, huge investment.
Yeah.
But it creates a totally different culture than one of the larger DSOs. I imagine that people feel as though they're part of a family,
Yes.
that they've got people that they're really close to, they know everyone. And the fact that you've recruited the majority of your dentists by referrals from your existing associates, I think that speaks
Good
to
point.
the benefit of your model. And your model, it's not going to be perfect for everyone. It's not going to work for every associate coming out of dental school, but you have enough people that are thrilled with it, that just love it, that they're going back to their friends that are still in dental school saying, hey, we struck the gold mine. Like we found a place that treats us like family, and you're going to get one-on-one time with the owner. You're going to get this awesome level of mentorship. If you've got any questions, they're going to answer them right away. You'll be able to level up your skills, and that's driving associates to your group in a world where, and Ken spoke to this earlier, there could be some fierce competition for recruiting associates. We've talked to a lot of groups that are having a hard time hiring.
You are absolutely right. Right now, I was in NYU for a Korean Dental Association, and there was another group recruiting on the other side. And the amount of sign-up bonuses they give to recruit these kids is nuts.
Yeah,
And these
wild.
kids, because we're coming out hungry, we have nothing, we have no money when we come out of school. You know, we're probably surviving on donuts and coffee. So we love it. We want it. We don't see beyond it. It's very different. And they get sucker punched with it. But they don't know that once they go in there, there are clauses. And those clauses are really holding them by their neck really, really bad. So we don't have any sign of bonus. I'm like, hey, you know, this is, our job description is very straight and clean. And I do my interviews. There's no operations manager who does the interviews. I was doing my own interviews. Dr. Lou was doing their own interviews because we want them to know that we're in the same grind as you are. So the thought process is the same and the expectations are the same. If you are expecting a sign a bonus style stuff, then we're not this place.
So on that note, I have a question that maybe this will be funny or hopefully it's not too distressing. But I'm curious, when you ask these new associates, when you ask them what's your goal, I'm interested for kind of what's the most wild answer that you've gotten when you've asked that question.
Wild one is they don't even know what their monthly expense is like. So they don't know what their goal is like. Their goals are sometimes, oh, I want to do a lot of veneer cases. I want to do all on full arch cases. And this is how I can tell that how social media is brainwashing them, that this is the first thing that you're going to do the first day you're going to walk in the office. Most of them. And the wildest part, like I said, is they don't know what their expenses look like right now. They don't know what they have to make in a month. I'm like, you work for a DSO, you work for a private practice, or let's say you work for your own self. You should know how much money is standard that you have to pay out, and then how much do you have to make in order for the payroll and other stuff to happen. So I tell them, let's go home, go do your homework. You don't have to tell me, but at least in your head, you should know what you're looking for. And then on that, you base your goals, right? If you don't even know what your expenses are, how are you going to make a goal for yourself? You're hearing all these words, 200,000, 400,000, 600,000. Do you even know how many zeros it has? Right?
That's right. Well, and even do they know what their cost to pay, I'm sorry, the interest on their loans? And do they understand how much that's going to cost and those sorts of things? So yeah, there's some interesting opportunity there. Maybe somebody will build a business that could just train new associates on how to do
Personal
life.
finance.
Yeah,
But
how
yeah,
to
some
do your
personal
own.
finance principles and things like that.
Yeah, how to do your own KPIs. Honestly, I learned it over time. When I was giving an interview, I didn't know. Also, I didn't know because like I said, we were living out on donuts and coffee. So when somebody comes out with, hey, you're gonna be on $1,000, or no, at my time it was like $600 daily guarantee. It seemed really good. It seemed amazing. I was like, yeah, sign me up. What do I have to do? Okay.
And then I bet you were the type of associate who said 600, I'm going for 1,000. I'm going for
Yes.
1,500 over time, right?
Yes.
Because you were building up your
Over
skill
time.
set.
Yeah.
Yep.
Yeah. Because, and that's the time I realized my gas bill is this, my utilities are this, my apartment is this much. And that's how you realize how you have to build your own skill and your chair time. You cannot be spending 1 hour on tiny little things. You have to increase your speed. You have to increase your skill. And it doesn't matter. People have this big bad notion about your DSOs. I'm like, hey, private practices, DSOs, associateship is a very good practice ground. Don't think you're going to practice or you're going to do something when you open up your own office. That's like when you're 47, you're done because you have concrete things in your head. Practice ground is right now, wherever you are. Even you're a student, that op room is your practice ground. Practice right now.
The other thing is that it's the thing that I love the most about dentistry is when those associates say, oh, wow, I'm going to work a full day because I need it for money and I need it for my lifestyle and whatever else. Well, that actually brings the best outcome for the patients as well, right? And so I love how ultimately there's alignment as they're coming out of school, figuring out how to get really good at doing dentistry. That's what this is all about. It's what it's all about.
Yeah. My nephews are coming out. They're in D3 and D2 right now. And their exams are not, the final exams are not on patients. It's on mannequins. And I'm like, so you don't have to numb the patient up? He's like, no, but they have a competency on it. I mean, the patient doesn't scream? No. You don't know how the patient's going to react to your anesthesia? No. Man, you guys need a lot of mentorship. I love
Yeah.
mentoring. I would
Yeah.
love to do it, but that's just how my mindset is. But there are 400 kids, 130 kids from different schools coming out and graduating right now. Today is the 15th. They're graduating 15th, 16th, 17th. And I'm like, man, this is like nuts. We need to help them. And that takes a lot of responsibility.
Well, it's about time to wrap up. So, Nazish, we're very, very grateful you've come on with us. Just as we're concluding, do you have any final thoughts for our listeners to wrap up the podcast?
No, I would say if associates are listening to the podcast, I'm sure you resonated with something that I said, because if you are a mature associate, you probably must have gone through some of this. And I know you're doing great right now. If you do get a mentor and if you do get a chance, an opportunity to become a mentor for somebody, I would highly appreciate it, because kids coming out nowadays, they really don't want to listen to a class 1, class 2 cavity or beautiful implants or beautiful veneers. They want somebody to have their back when they make a mistake. Non-judgmental, they need some help right there. And it would be a good opportunity for us as clinicians who've gone through it to help some new kids to
Thank you so
progress.
much. And Dr. Jaffrey, would you mind just sharing your any contact information? If somebody's listening to this and wants to reach out to you or connect with you in some way, feel free to share right here, just how they can connect with you.
Absolutely. Like I said, I am on speed dial for my associates. Anybody who's willing to learn, you don't have to work for us, but I have some wisdom that I can share, some tips. My name again is Nazish Jafri. That is the email at secure-dental.com. If that feels too long, our office is Secure Dental. And you can find me on LinkedIn, on Facebook. A lot of things just come directly to me. And after the podcast, there would be some links that they can maybe click on.
Yeah, we can include those in the show notes.
Sure. Perfect.
Absolutely.
Yeah, thank
Again, thank you so much for being with us.
you. Thank you.
And we'll see you next time on the podcast.
Absolutely. Thank you. Appreciate it.